Hi, my name is Casey Ewell. I am the director here at the Center for Wound Healing at FHN Memorial Hospital. We are located on the second floor of the Stevenson Street Specialty Clinic. We're here today to celebrate our 10-year anniversary here at FHN. So welcome to our virtual tour. First, I'd like to introduce you to Dr. Roland Taliver, who is our administrative director.
Here at the Center for Wound Healing at FHN, we are able to provide services for patients with all types of wounds, including surgical wounds that are failing to heal, diabetic ulcers, venous stasis ulcers, pressure ulcers, vascular ulcers, bone infection called osteomyelitis, in addition to osteoradionecrosis, which is an injury that has developed because of radiation therapy. We've even treated patients with frostbite and other crush injuries as well. So our goal initially when we first opened was to set up a center of excellence in our community that could provide these services all in one location, and that is our Center for Wound Healing at FHN. We decided in 2009 that we were going to start something along these lines, and it took a couple of years before we finally found the right organization to join with us, and that was Restorix Health. They were able to provide us with not only the training for wound care services, but the hyperbaric oxygen therapy, and provide us with an excellent nursing staff that helps on a daily basis to manage these wounds. Our providers here are able to take care of wounds from head to toe. We are able to take care of wounds that have developed not only in the hospital, potentially at home, and also in nursing centers. So our goal at this point has always been to basically be able to create a system in order that we can have a standardized way of managing these wounds and being able to get these patients healed as fast as we possibly can. Our center typically sees patients on a weekly basis. For the ulcers, sometimes it's more frequently, and if they're receiving the oxygen therapy treatments, then it's usually going to be approximately 5 days a week. Our center has been providing services for the past 10 years, and we have been working in conjunction not only with Restorix as stated, but we are working with FHN in order to provide radiology services, vascular services, laboratory services, and when needed, hospitalization, and oftentimes these patients may also require surgery, which our staff can provide for certain conditions. So we have worked in the community for this entire 10 years. We've seen patients from Madison all the way down to central Illinois over to the Galena area, and our basic referral source are other physicians. However, patients have self-referred, and many patients, because they've gone on to heal beautifully, they then will send patients to see us at the Center for Wound Healing at FHN.
I'd like to take a moment to discuss our patient successes here at the center. This is something we are very proud of. We've had 22,000 visits in the last 10 years. Our healing rate is 97%, and the national average is 90%. Our days to heal is 28 days, with the national average being of 32 days. Now, I'd like to introduce you to Dr. Rafael Castro, who is our medical director, who's going to speak to you regarding our hyperbaric oxygen treatments.
Hi, I'm Dr. Rafael Castro. I'm co-director of the Wound Center. We are in this section of the Wound Center where we have our hyperbaric oxygen chambers. We have 2 of these, and this is a single place chamber designed for 1 person. Hyperbaric oxygen is a form of treatment to heal wounds. Hyper is meaning above normal, and baric is derived from atmospheric pressure. At sea level, the amount of pressure exerted on the person is about 760 millimeters mercury, and within the chamber, most of the pressures is 2 to 2.5 times the normal. The patient also breathes 100% oxygen. So what happens is oxygen is saturated within the plasma because of the increased pressure and the 100%. And because of that, wound heals with a greater chance because of the 100% oxygen and greater saturation of oxygen within the plasma. In so doing, we prevent loss of tissue, loss of limb, and we prevent amputations.
This is our healing tree here at the center. This tree signifies everybody that we have healed at the center within the last year. When somebody heals, they're able to put their name and the date that they have graduated. This leaf signifies their healing at the wound center, the time, the commitment that it took for them to heal their wound and to heal it correctly. So we use this as kind of a mini graduation ceremony to celebrate them and their commitment that it took to heal their wound. That concludes our virtual tour. I'd like to thank you for joining us for our 10-year anniversary.